today's the 15th of April, and I'm here with another update. I have contacted, I have had to change my mind about the gastric balloon and where to get it done, because the logistics with Turkey are just too many. I'm not able to figure that out, and I feel like it's kind of, you know, taking the wind off my sail, and I really want to, you know, get this done as soon as possible. I have got the dates. I had already asked for days off at work, so the dates from the 10th to the 13th to the 15th actually. So I've got 5 days. Yes, from the 10th to the 15th. I had asked for those days off from work, and I got them. So I have to have my procedure by during those dates. So the time constraint gives me a challenge in having to apply for a visa to Turkey. I live, like I said, 5 hours away from Copenhagen, where the Turkish consulate is, where I have to go and apply for my visa. It's just not gonna cut it. It's just not gonna cut it. I have a full-time job. Getting back and forth is just it's just too much logistically to figure out. And then within that time constraint, a little time constraint that I have, it's proving a challenge. So I went back to the drawing board and decided to look at other options. I started looking at Denmark again, and still unconvinced about Denmark. So I started to look outward again, and into the Czech Republic, and alas, I am the one who had not been looking properly. I suddenly found what I was looking for. I have narrowed it down to 2 clinics that do these procedures. One of them is actually very good. The other one is the advantage of the other one is the fact that they arrange everything for you, flights, accommodation, everything. So they take care of everything for you, and contact and put you down to doctors down there. So it's like think of a tour operator that kind of just does this itinerary for you, but this is medical tourism, so they kind of create a package for you to get to the Czech Republic and get it done. They are based in the UK, which means that it is cheaper to do it from the UK with them, but they're willing to help me. It's just not working. I don't think it's an option. I don't think it's an option, especially because they're not really disclosing what clinic they're going to use in the Czech Republic. I would love to check out the reviews of the clinic. I'd like to see what people are saying about it, and they will not disclose that. So I'm a bit, worried about that. So that's probably not the option I'm going to go with. The other one is a clinic that is in the Czech Republic that I found. And I've read reviews. I have spent the last couple of days like burying myself in that research, finding people who have had surgeries there, and they do all kinds of surgeries. This is the capital. While Turkey might be the capital for bariatric surgeries, the Czech Republic is the capital for plastic surgeries. Like, if you want to come out looking like a different person, this is the place you want to go. As I see, a lot of people that use it are from the UK and Germany, that go to the Czech Republic for that. And I think it's also because they do not need visas to go to the Czech Republic. I know at least that for Germany, because Germans would need to go to Turkey. No, actually, no, Germans don't need to go to, they don't need a visa to go to Turkey for bariatric procedures. But they are going to the Czech Republic for other things. So mostly what I have been able to uncover is that most people will put 2 surgeries. So they will start with an eyelid surgery, or like a nose job, or like, lips or whatever. They'll fix what they need to fix, and then take a balloon afterwards, or they would do an eyelid surgery and a rhinoplasty, or they would take Botox somewhere and a mummy tuck somewhere, or that kind of thing. So people kind of combine surgeries when they go to the Czech Republic and have many things fixed at the same time. So, but I have also found some that have gone there for the sleeve, the bariatric sleeve, and the bariatric bypass, as well as a balloon. And so of course I got very excited about that, and I started reaching out. I started reading all the comments, and then I reached out to the clinic, and the clinic sent me a mail. So one of the people that kind of organizes these things, because they have a lot of guests coming from abroad. They have you get like a caseworker assigned to you. So my caseworker contacted me and sent me a whole email with all the information that I needed to have about the balloon, how much it costs, what it involves, what the different kinds of balloons, and actually, give me a minute, let me go get it. And I'm back. Yes. So they sent, his name is Oliver, and he sent me like a mammoth, like a huge mail with all the information. So in this, he writes, because I had told him what I wanted. I've kind of, at this point, I know that I want to get the Schwarz 3 balloon. So I don't think I want to waste my time with, someone explaining how the balloons work and all that, because it's just time that I don't have. So I had written to them and said that I wanted to get a Schwarz balloon. I wanted to find out what they offer and how much it costs. So he sent me the mail telling me, of course, that apart from the Schwarz 3, they also have the Obera and the Obera 365, and kind of did a bit of just an information again about how that works. And then what I love about them is that he went in and he kind of details the process, what I should expect should I choose them. So a brief introduction of what you're gonna get once you've chosen which of the balloons you want to have. Then he went on to do consultation and insertion. So they have 3 days that they do that. They do Monday, Wednesday, and Thursday. Those are the days that they do bariatric stuff, and bariatric balloons. That's when they do the gastric balloons on Monday, Wednesday, and Thursday. So you need to and they start up very early at 7:30. That's when you get into the hospital to start getting your checkup, when they do all the all the tests that they need to do before they do the procedure, to find out if you are a good candidate for the procedure. So and then so you should ideally arrive the day before, and then now on 7:30 in the morning you go for your checkup. They do blood tests and ECG, and they say that the internist is English speaking. The person who does the tests is English speaking, which you want, unless you speak Czech. What's the language they speak there? Is it Czech? Oh my god, I don't know. I feel so ignorant right now. Is it Czech? Unless you speak the local language. You want someone who speaks English. And this is actually one of the main things that you need to be careful and you need to be aware of when you go to the Czech Republic, is that to make sure that they have a team of the team that will be taking care of you speaks English all through. I have read reviews of people who went and nurses do not speak English and they had to administer stuff. So they just kind of, there was a language barrier where the patient did not know what was happening, or was asking for something that they never got, or, tried to explain that they had pain, but nobody really understood, all that. And this is especially for the bigger surgeries. So it's very important. And that's also why I wanted to know with the other one. I'm not going to mention which one it is, the other one that I was considering, because I'm just uncomfortable in not knowing what clinic I'm going to have it done at. That's it. The people who are okay with it, that's up to you. So I will not say anything to, to discredit them in any way, shape, or form. I don't know anything about their business. I don't know anything about how they run their business. So I will not be doing that. But for me, it is important for me to know what clinic I'm going to be having the procedure done, so I can do my research on it. And that was really, advised, that my wanting to know what clinic is really advised by the fact that I have really, really seen people who have had not very good experiences with that. So that's why. So yeah, of course, and then they go ahead and he says that if there are no contraindications arising from the checkup, then the gastroscopy can be done. So that means they'll just put in the balloon that way. And that's if they don't find any ulcers or any other defects. Then they can insert the balloon at the same time. So after that procedure, you're taken to, and this is one of the other things that is very different with Turkey. After the procedure, you're taken to the inpatient ward where you stay one night. In Turkey, you do not stay at the hotel. At the hospital, they take you to a hotel. You stay at a hotel, and that kind of can depend. I think that and it's worked out fine for people. It has worked out very well for majority of people. But there are also those people who become dehydrated. We need to also consider the fact that you have not eaten since 3 p.m. the day before your procedure, and you've not had any water since midnight the day before your procedure. So that means, and then you get this balloon inserted, and you're not able to keep anything down, which means the chances of you getting dehydrated are very, very high. And that is one of the biggest challenges with the balloon. And when you're traveling, that's also why they advise for you to stay for 2-3 nights, for 2 nights, 2-3 nights at the place. Just give me a minute. I can see just give me a minute. Yeah, so so these guys will keep you at the hospital for one night, and they say the hospitalization is an essential part of the treatment and serves in particular to ensure adequate fluid intake and medication to calm nausea and abdominal pains. Now, we already know that these are some of the very common side effects with the balloon being put in your body. And a lot of people get nausea and abdominal pain. So the fact that you are at the hospital and you're having people take care of you during that first night, I think it's absolutely vital. And then the next day, your physician comes for checkup, and you can leave. Back home. You can leave for home. Is what they mean here. So before leaving, you will get advice about the diet, information about time after the medical performance. Before leaving, you'll get advice about diet and information about the time after the medical performance. So after you've gotten your checkup, then they will give you info about your diet and all stuff. And all that stuff. Then they also say it is recommended to come with somebody who helps you with luggage and accompanies you. And this is where my challenge is. I do not have anybody that I can ask to go here with me for 3 days. Because if you count the day of arrival, the day of the procedure, and the day of the checkup, and when I look at the flights, I'm actually not able to fly out on that day. My third day there, I'm not able to fly out that day, because the only flights I can find are at 9:30 in the morning, which I wouldn't want to risk because I don't know what time this checkup is at. So if that checkup is at 8 o'clock, I would not be able to make it to the airport. So I'm definitely going to take another extra night and just get a hotel, which also kind of makes me calm a little bit down also, because then I will have had the balloon in for at least 48 hours before I leave, before I start to travel again, and my body will have started, acclimatizing with the balloon, getting, okay, acquainted with the balloon, so the effects will not be as severe as, the first day. Yeah. And then, of course, like they say, you should be aware of having nothing to eat from 3 p.m. the day before your procedure and drink from midnight before the procedure. Smoking is also not allowed from midnight. The checkups and the gastroscopy itself are done on empty stomach. Driving is not allowed 24 hours after balloon insertion. Yes. And then they say there's no medical care needed in the time after the insertion. Yes. Okay. Yes, so that's about it. And then they sent me this questionnaire that I have to fill out and then send back to them. And then it just goes with you have to tell them all the diseases that you have or do not have, like literally. And then I think like I mentioned, with the gastric balloon, that this is so much mental. It is you changing your relationship with food, and it is you really digging deep and going there about why you really have added the weight that you've added and why you are the way that you are. It kind of gives you the space for you to process this. That's also why I mentioned that I don't think it's the best thing for anybody to do this without support. I have done a lot of research in this, and I have found out that a lot of the people who have lapsed back and gained all the weight was actually because they didn't get support. They did not have the support that they needed to be able to make the changes that they needed to make. So one of the last questions here that they ask, what is the main reason for gaining weight based on your own point of view? Then they have some boxes you can tick: excessive food intake, maternity leave, stress factor, this is family or work issues, illness, career changes, military service, low physical activity, menopause, pregnancy, marriage. And then they also have like a block of other factors where you can write a little bit more about why you think that is. And already there you can see that they're inviting you to start, asking yourself really difficult questions, and holding yourself accountable for where you are, and the struggles that you're experiencing. And I think, to be quite honest, that is really, I think it really captures my paradigm going on into this, that I want to be able to ask myself those hard questions, and I want someone to hold me accountable. I'm also holding myself really accountable, for where I am right now. So yes, so Prague it is. I don't need a visa to go to Prague. About the costs, it's going to cost. They send me. Oh, it's going to cost, because I'm waiting for the Spatz balloon. Maybe I can just go ahead and give you the prices and these are prices that are valid from August 2022. I don't know when they're valid until, so I'm just telling you the ones that I have here. The gastric balloon Opera, the 6-month one, is 1850 euros, 1,850 euros. The gastric balloon Opera, the 12-month one, is 2,250, and the Opera 365 is 2,250 euros. And then my favorite, the Spatz, which is also a 1-year one, is 2,450. And then on top of that, you have to pay 200 euros for the pre-operative examination. You have to pay 120 euros for hospitalization. And then if you're getting the Spatz balloon, that price is included, because it's the enlargement of the balloon, Spatz only. One enlargement or one adjustment is free of charge, and then the removal of the balloon for all of them is also free of charge. So it's included in this price here. So the total costs include complete preliminary examination, so internal medical examination, including blood tests and ECG, gastric balloon, anesthesia, gastroscopy, and insertion of the gastric balloon. post-operative care, inclusive hospital stay, all medical materials, medication, and that is the PPI for 3 months, medication for acute symptoms, adjustment of gastric balloon, that is for the Schwarz balloon, inclusive preoperative examinations and anesthesia for the Schwarz 3, of course, and then removal of the balloon, inclusive preoperative examination and anesthesia, and then also 1 airport transfer. A deposit of 350 euros is required in order to hold your balloon insertion date. So that's what you need to know. Yes. Yeah. Okay. I think that's about it for this. And then they sent me all this, important the things I needed that were important for me to know. I needed to inform them about my current medication and diseases. And then they also recommend that you cannot have this procedure done, like if you have been taking oh my gosh, why is it so dark? Sorry, I had to stop that because I noticed that the camera was very dark. It was very dark because I was getting a lot of sunshine from the window right over there, so I just kind of turned off the blinds. I hope it's better now. Anyway, you cannot have this procedure done if you have been taking antibiotics, and if you have been taking antibiotics, you need to give yourself 4 weeks, at least 4 weeks, before you think about having this procedure done. Yes, and then they say also a possible contraindication to your treatment could be a damaged stomach lining, and for this they recommend the intake of proton pump inhibitors, so the PPI, and they've got the omeprazole, the pantoprazole, and that these are in 20 and 40 mg daily. And if you have a damaged stomach lining, it's good for you to have those done, to be taking those from the time, as soon as possible. Of course, you also get these PPI pills for 90 days. So 90 days after, you take 1 pill every single day after your procedure has been done, and that is also part of the package with them. They also talk about the complications here. They say that nausea, abdominal pain, vomiting, and this usually persists for a couple of days, so 3 to 5 days. And then they talk about the rest. All the others are very rare things. But they also say that weight loss is not guaranteed. The reduction is individual and depends on your age, eating habits. So dietary guidelines and plan must be followed for you to be able to get a successful to be able to achieve success with this. Yes, okay. Yeah, right. So that is about the gist of it. So we are going to Prague, and I am going to be using the ice care. Those are the people I'm going to be doing. I'm going to show you, that is them. Ice care. It's what I'm going to be using for the procedure, and they are in Prague. So on top of all this, I need to on top of the 2770, I need to think of flight tickets. I also need to pay for accommodation for 2 nights. So 2 nights at a hotel, one on the first night, the day of arrival, that night, and also after I have been released from the hospital, I need to spend a night there, so I'm able to catch a flight on the following day at 9:30 a.m. So yes, so that's about the plan that we are working with now. I am very, very excited, and like I mentioned, this right here is a diary for myself to help me keep myself accountable, to also see how far I will go from here, because it can only go up from here. Oh yeah, okay, so the weight can only go down from here, and I can only go up from here in terms of how I feel and in terms of my physical health. So yeah, I will be documenting, like I mentioned, also every single day what I feel. I'm going to be doing a review of the clinic from arrival. I actually will take it because they only give you one airport transfer. I will have to figure out how to get an transfer from an airport transfer from. Yeah, I'll have to figure out about airport transfer on the day of arrival because I would much rather use the cab. I'd rather use the airport transfer on the day of departure than on the day of arrival. Or maybe it's best. Oh, yeah. So with this package, I get one airport transfer, and I'm thinking that the best thing is to take the airport transfer on the day of arrival because I will be completely new. I have never been to Prague before. I'll be completely new, and I will need someone to help me figure it out. So I will be documenting my journey from the airport, literally, from the airport to the way they pick me up and when they try drive me to the hotel. I have a conversation scheduled with Oliver in this coming week. We're going to talk about all these other small things. I have a few questions, and I'll come in and update you on how this goes. Okay. All right. So thank you for watching, and we'll see you in the next one, I guess. The next update. See you.